This class is about social change and social development. In the past, we've been able to cover various development perspectives and theories. Right now, we're going to discuss gender and development, which is one of the many approaches which we need to understand as we apply these theories into actual social work practice. People say that feminism is passé because we have already entered the post-feminist era. Do you agree to this statement? I think this is a highly contentious observation, and perhaps after this presentation, we will revisit the statement, whether it is true or not. What you see in this photo, you can see two grown men and two girls. They're actually married. This is an important and serious problem that are faced by a lot of girls in the world today because of arranged marriages. So there are 21% of young women in the world were married before the age of 18. Child marriage is a human rights violation, and you know that girls who marry before they turn 18 are less likely to remain in school and also more likely to experience domestic violence. Young girls are also more likely to die due to complications in pregnancy and also in childbirth than women in their 20s. And their children are more likely to be stillborn or die in the first month of life. These are women fetching water for their family and also doing childcare. In a lot of cultures, especially in South Asia and Africa, women spend around 3 to 5 hours a day to fetch water for the families. And this is because it's the role that was given to them. Gender roles burden women, which limit their use of their own personal spare time. It restricts women's ability to invest in gaining skills, education, and other improvements. It also raises the opportunity costs of working and hampers women's capacity to earn income and be able to integrate into the labor market. And this also happens among small girls. The loading and the burden of fetching water limits their ability to attend and finish school. This is a colorful depiction of inequality experienced by women both at home and at the workplace. At the workplace, for example, there's inequality not only in opportunities for promotion but also in wages. While at home, women are expected to perform most of the household chores, including taking care of children. As an example, in the US, women make less than half of what men make. A report in 2018 says that the global pay gap between men and women will take 202 years to close or to even out. Also, it's important to note that mothers spend 15 hours a week on childcare as compared to 7 hours spent by fathers. This is an interesting photo in 1920. These are women who fought for the right to vote. Their movements and protests, both peaceful and radical, allowed for the nationwide right for women to vote in 1922, and this is in the United States. Now, this is a presentation about gender theories, gender in development concept, which have the roots in feminist theory. And this is a good definition of feminist theory as a political and social discourse that critically examines gender inequality and other systems of oppression that are institutionalized in the workplace, the family, or marriage. Under feminist theories, there are various perspectives, and these are some of the feminist perspectives that are important in social work practice. For example, liberal feminism, it focuses on women becoming free by gaining access to the same opportunities as men. It opposes limitations on women's educational and employment opportunities, for example, and demands equality in opportunities in various facets of life. Radical feminism, what is it? It acknowledges patriarchy or men's power and privilege as a social system and as the root of women's oppression. And then we also have Black feminism. This perspective says that voices of women of color are often excluded from feminist theorizing, and that this perspective highlights racism and Black women's experience to the history of slavery. So this is a kind of different perspective on feminist struggle. And then we also have postmodern feminism, which is involves construction of social categories of sex and gender through language and discourse. The focus of this perspective is to reject socially created categories or biases. And of course, we have socialist and Marxist perspectives, which focus on intersections between class and gender oppression. If there are inequalities among classes, these are manifested as well in terms of gender relations. Under capitalism, women are reserved army of labor and are exploited for free labor at home. So that is the focus of the socialist and Marxist perspectives on feminist theories. Now, let us define what feminist social work is. Now that we understand the various perspectives under feminist theories, what exactly is feminist social work? Uh, Lena Dominelli defined feminist social work as the practice that takes women's experience of the world as the starting point of its analysis. And by focusing on the links between a woman's position in society and their individual predicament, social work practice responds to her specific needs, creates egalitarian relations in client-worker interactions, and also addresses inequalities in systems and structures. There are two important points that we need to remember in feminist social work, and that it caters to women or woman-centered approaches, which advocate sensitive gendered responses to the needs of women clients and women workers. It also challenges gender-blind theories and practices. Many people would ask, what now for social workers? Why is it important to understand gender issues when we engage with our clients, may it be individuals, groups, or communities? And I'd like to go back to this slide, which I used in the past. which says that it is not enough for social workers to believe in social justice and equality. Rather, it's important to understand oppression and the dynamics that reproduce it. Social workers, in this sense, must understand forces of oppression, privilege, power, and liberation. And gender perspectives enable social workers to have that gender lens or perspective that enables us to see the forces of privilege and power among genders. Now let's go back to this slide which shows us um, the tension between oppression and privilege. And by oppression, we mean the system that maintains advantage and disadvantage based on stereotyped social group memberships. Applying this to gender theories, we know for a fact that because of gender, women have experienced oppression and have suffered from inequality all over the world. And in terms of privilege, which is enjoyed by men, um, it is defined as unearned, unasked for, and often invisible benefits and advantages not available to members of disadvantaged groups. We can apply this framework when we understand gender in development issues. There is that oppression and also a privilege. We know for a fact that women have been oppressed and have experienced a lot of unequal treatment, but how are these manifested? How are these measured? And in the following slides, we will be discussing various tools for measuring gender equality. The Gender Social Norms Index was introduced by the United Nations Development Program to measure gender equality among countries. And briefly, I'd just like to explain that it makes use of four dimensions in measuring gender equality. These are political, educational, economic, and physical integrity. Under political, of course, we have um, political leaders. Do men make better political leaders than women do? Do women have the same rights as men? And under educational, um, the measures and indicators cover whether university is more important for a man than for a woman. And then we also have economic dimensions, which cover economic empowerment. And under physical integrity, um, there is what they call the proxy for intimate partner violence and the proxy for reproductive rights. I'm showing this to you just to give you an idea of um, how institutions like the UN have come up with tools to measure gender equality, and this entails a lot of survey and quantitative data. You might be wondering how we are doing. If you look at the Gender Social Norms Index for the Philippines, we are actually ranked 98 out of 162 countries according to the 2018 index. And then, interestingly, um, they also indicated that 29.1% of government seats are held by women. And 75%, 72%, these are percentages of adult women who reach at least secondary level of education compared to 72% of male counterparts. So women, a bigger percentage of women in the Philippines are able to reach at least secondary level of education. I'm sure you've heard of gender lens. How do we develop gender lens when we help people? How do we develop gender lens when we engage individuals, when we engage groups, when we work with communities? I would like to show you a gender assessment tool which is implemented by the WHO, and they have come up with a list of questions to assess whether a project is gender sensitive. So they utilize a certain scoring mechanism for the questions. I just wanted to show this to you to give you an idea, and perhaps in your other courses or when you go to field instruction courses, you can actually try to apply this when you go to the community. One of the questions would be about the vision, goals, or principles of project, whether um, they show commitment to promoting or achieving gender equality. And then it also covers sex as selection criteria for target population, policies and programs, and then participation of women and men in the design, implementation, monitoring in the different parts of the project. Or are the women, um, do the women dominate the decision making? Are the women able to participate at all, or they still need to fetch water and take care of the children, so they're not able to participate? There are 23 questions under this gender assessment tool. And it also includes family or household dynamics, and whether the program include stakeholders with gender expertise as partners. So this is a comprehensive checklist implemented by the WHO. To continue, these are the rest of the questions, 23 total questions, just to assess whether a policy or a program or a project that's being implemented promote gender equality. And the trend now is that in international institutions would require this if you want to get funding from funding donors. They would require a gender assessment of your project. This is a gender checklist for health projects, which is carried out by the Asian Development Bank when they develop or conceptualize projects in the countries where they operate. And this focuses on health projects, as I have mentioned. And these are some of the questions that they would like to know. Whether there are discriminatory provisions or implicit gender biases in the policy that could disadvantage women and girls. And then, are there formal or informal barriers to women's access to health services? This could be social pressure for early marriage, just like what I have shown you earlier. And then social norms which limit women's mobility. Um, and then there's also community tolerance for domestic violence. And note that this checklist is applied in many countries in Asia and the Pacific, which means that even countries which promote child marriages, ADB requires that, you know, all projects go through this type of checklist for gender equality. Part of the checklist is also to determine whether there's gender balance among stakeholders like the government, staff hospitals, health centers, um, and whether there's changes in the policy framework proposed under the project. So it's quite detailed when an NGO or a government would like to submit a proposal for financial assistance, then they have to go through all these checklists to get approval. Now, I think it's important for us to be able to apply feminist theories into actual live programs and projects. And this is based on a report by UNFPA, which was published in March 2020. Based on the study, they say that women and men are impacted by COVID-19 differently. For example, the gender norms, some of these gender norms pose risks to women. Women do not have autonomy over their sexual and reproductive decisions, compounded by their inadequate access to healthcare. These things happen because of the socially prescribed gender norms and the role of women. Women are always at risk because they do not have autonomy over important decisions that affect them. So this is an important point that we need to consider as we look at programs implemented to address COVID-19. And then secondly, it's interesting to note in terms of division of labor, 70% of the global health workforce are women. So that's a high number of women facing the risk of infection. And then third, there is an increase in gender-based violence in times of crisis. This is perhaps due to heightened tensions in the household, which put women at risk. The study presented the following recommendations. Gender response to COVID-19. One is that any program should ensure that high attention is given to sexual and reproductive health during COVID-19, which include adhering to safe pregnancies and childbirth. And also, you have to consider how quarantine can be different for women and men, such as whether women's and men's different physical, cultural, security, and sanitary needs are being met. It is also important to make sure to recognize that the home may not be a safe place for some women and may indeed increase exposure to domestic violence. And I think this is true also especially in the Philippines. And lastly, one of the recommendations is to include women in decision making for outbreak preparedness and response, and ensure women's representation in national and local COVID-19 policy spaces. So this is an example of um, integrating gender and development theories and concepts in addressing COVID-19, how gender issues are part of the program design. Make sure that equality is observed as we address problem during the pandemic. I'd like to end this presentation by showing you this statement again, which says that feminism is passé because we have already entered the post-feminist era. And I think all of you will disagree with this statement. While we have had substantive gains in the last decades in promoting gender equality, there's still a lot of work that need to be done. While there are many beautiful policies written on gender, it's also very challenging to see these policies implemented on the ground. So I hope you find this presentation useful. Thank you.